Good morning, everyone. Thank you so much for joining us today. My name is Amanda Kelly Thompson. I'm the Director of Advancement in NAMI Delaware, and I will be moderating today's presentation. We want to start off by letting you know that you are not alone. This is a difficult time, and what we may talk about today could generate some strong feelings in you that you don't expect. So it's important to know that you can access the crisis support 24/7, no matter where you are. For the National Crisis Text Line, you can text DE to 741-741, or you can access the Delaware Hope Line by calling 1-833-9-HOPE-DE, or by texting DE HOPE 55753. This session is sponsored by Synovian Pharmaceuticals. Synovian is a global biopharmaceutical company focused on the innovative application of science and medicine to help people with serious medical conditions. Synovian's vision is to lead the way to a healthier world. The company's spirit of innovation is driven by the conviction that scientific excellence paired with meaningful advocacy and relevant education can improve lives. With patients at the center of everything we do, Synovian has charted new paths to life-transforming treatments that reflect ongoing investments in research and development and an unwavering commitment to support people with psychiatric conditions. I'd now like to introduce our presenter, Major Sam Cochran. Major Sam Cochran is nationally known for his work developing the CIT model. He was the coordinator of the Memphis Police Crisis Intervention Team, which started in 1988 from an outpouring of community partnerships. He holds a master's degree in political science and criminal justice from the University of Southern Mississippi. He retired from the Memphis Police Department after 33 years of service, which include numerous assignments, including coordinator of the Memphis Hostage Negotiation Team. Retiring in 2008, Major Cochran joined the University of Memphis as a CIT Project Grant Coordinator and as a coordinator of the CIT Center. Major Cochran is passionately engaged in many services promoting CIT as a community program, more than just a training. In addition to receiving the University of New York, John Jay College of Criminal Justice Law Enforcement Newsperson of the Year Award in 2000, the National Alliance of Mental Illness named an annual Law Enforcement Advocacy Award after Major Cochran. This presentation will have a question and answer session at the end. Please type any questions you may have in the chat box, and we will try to answer as many as possible. I will now turn it over to Major Cochran.
Well, hello, great Delaware champions. This is Sam Cochran, and it is an honor for me to be here with you with regards to this presentation. I want to let you know I have worked really hard on this presentation because I know I have a very diverse audience with regards to CIT. The presentation is going to be about CIT. I've tried to make it interesting so that everybody will have at least something to meditate on, to think about, to consider. And I think that that would be helpful because I'm sure that we've got some very robust champions out there that are very versed in CIT, got excellent performance from their community. Things are going really great. But at the same time, I said, hopefully we've got some new people who hadn't quite jumped into the CIT circuit, so to speak. So let's see how we do on this. And if nothing else, I hope my PowerPoint slides will entertain you a little bit. I worked hard to try to draw an interest to the viewer as well as content information. So the very first slide here you're looking at is something to think about. And again, I'm targeting towards Delaware. That's my audience. And we'll see where we go from there. And so for your medication, and it's kind of a question, is Delaware CIT on track or off track, off target or on target? And those are the things that we're going to be just kind of looking at or viewing some of the slide messaging with regards to CIT and how you might judge your community or your CIT performance. I'm supposed to, Amanda, advance the slides, and that's not happening.
Yep, I'm not seeing it move forward.
No, I'm, let's see, we're there. Did I do that or did you do that?
Nope, you did that.
Okay, well, let's see where it goes. All right, so here's some of the lesson platforms that we're going to be talking about today. And again, they're not in necessarily in this exact order, and I will be repeating some of these message points on different occasions under the context that I'm presenting it. So if you're saying, well, I think he said that, I probably did. Repetition is all about learning. We're going to talk about that. We're going to be talking about the partnerships in the community that needs to be engaged. We're going to talk about the importance of planning. Of course, you've got to sustain CIT, and that's going to require a certain level of nurturing. We're going to be talking about some issues that still loom, and that some say these are issues that should draw some concern that we might have. Leadership is very important to talk about. We're going to be also talking about the program itself, the design, some of the anchors, how important it is for evaluations. We're going to talk about the training curriculum, the line in the sand. I'll wait and bring that up in a little bit more in detail, as well as the 10th point. I'll bring it up a little bit later on. We're supposed to fight. And we'll see how we connect the dots here. This is one of my favorite slides I introduced a few years ago, because learning is a very key component to CIT, and a lot of times people think that learning is all about training. Well, learning is a very important part of training, but learning also has to do with learning about the program itself that we call CIT. This is a professor out of the University of Virginia by Robert Verna, and he introduced an article, and he said one of the biggest mistakes a teacher can make is to forego the return to repetition. Repetition matters because it can hasten and deepen the engagement process, learning. And that's something that I think that especially our trainers, we need to take serious consideration how well we're delivering a teaching moment and whether or not that teaching moment becomes a learning moment. And so we're going to be, trust me, we're going to a little bit later on, we're going to get a little bit further in detail with regards to training and making training a learning platform, not just a teaching platform. This is a cartoon that I'm introducing here, and it's there's a couple. The messaging of this cartoon really comes into play with regards to how not to have a committee. And many of you know your engagements with CIT as a community program usually starts with a steering committee or a task force committee, and they have certain agendas that are assigned to them. And I think this messaging here speaks well, just from the comment with regards to their agenda. But also, I think it speaks well to note the lack of diversity on that committee. And so this is not a reflection of a good steering committee with regards to the performance of shaping CIT into a community program. It's very, very important. And yet, a lot of times people minimize CIT. They tend to focus everything towards training, and they fail to develop a program that's considered to be a community program. And I think this is a classic example. This cartoon represents a committee that's not doing its due diligence to engage CIT as a rightful place within the community, and to have community ownership of CIT. This is an important question I oftentimes ask when I make presentations. I bring up, says, okay, I know what officers that graduate on Friday. Usually there's a graduation on last thing on Friday. The new CIT officers are about to go into representing their new CIT status from whatever agency that they're representing. And that graduation really brings the entire week, the 40-hour week, to I think to a performance where the officers are really have a strong ownership of their role as a new CIT officer. But the question needs to be asked, and I challenge communities that when you're going into this, hopefully you'll be addressing this before, but if you're at that graduation and you have not addressed some of the issues that fall within this question. The question is, yes, officers are walking away from great CIT training. That's that 40-hour training week. But the real consideration is, but what are they walking into? And a lot of times people say, what do you mean walking into? Of course, I got that bridge there. That's something that you might not want to be eager to walk on in crossing that river. But I use that symbolically to illustrate that officers are walking out of great training, but sometimes they're walking into very fragmented system issues. Sometimes the fragmentation of system issues or not attention to some of the system issues that are in place, it tends to direct officers more to the criminal justice system as opposed to the mental health system. So most it's not intended to be that way, but one of the things that CIT must, and I really emphasize this a lot, is to look at the local, regional, state mental health services and make sure that those system issues are in place and to make sure appropriate funding is in place. CIT is a great program, but if you don't have those great champions in the realm of partnerships, the training can only carry you so far. And so most of the time when we're looking at system issues, and we're looking at mental health services, but that's not the only system. There's other community systems that should be in place or at least be examined. Housing is a very critical component with regards to recovery. How well that we connect other services and linkages to the recovery efforts of individuals with lived experiences is very, very important and very, very critical. So ask the question, the officers are walking away from great training, but are we also addressing those system issues to make sure that the officers are going to be able to perform in not only a crisis environment, but also to have some level of ownership. This is another weak part. Some of the CIT programs, officers understand their crisis role, but I want officers to have an ownership that they're part of the recovery process. I tell my CIT officers that recovery starts when you arrive at the scene. A lot of times, if you look at some of the CIT programs that are not investing that transformation of officers to ownership of who and what they are in performance of a CIT officers, they're thinking that the word recovery applies to somebody else. And I said, no, you're minimizing your role as a CIT officer. I want them to have some level of ownership. Yes, they're only going to be partially with an individual in crisis, but the role they play at that crisis and that delivery to a great mental health service system is all part of the network of what we call recovery. And that's a word that we need to make sure that's not only a part of training, but it's a part of our identity. You can't have a journey without a destination. So CIT is intended to have a vision. It's intended to be engaging. That steering committee you looked at earlier with regards to the cartoon, they were not very engaging with regards to that. So what is the CIT mission? Those are things of what those partnerships have to come to the table to discuss. They have to discuss where are we going with this program we call CIT? What is our mission? And are we able to establish an identity? Again, I think one of the weak links to some of the CIT efforts, their identity is strictly on the 40 hours of training and nothing more. And that's minimizing the purpose and intent of CIT. If you're engaging, if you have a mission, if you're seeing the vision, and if you're treating the program as a specialist or a specialty, okay, that identity will have a meaning with regards to not only the officers, but a meaning with regards to the community. And that's, again, you hear me saying over and over again, it's part of the repeating that I do to instill the point. CIT is not a training program. Oh yeah, it's a great training, but CIT is really a community program, and that needs to be underscored. So how do you achieve a very robust CIT community program? Leadership has got to be a part of that. Responsibility and accountability. These notations here are all or overlapping to some degree, and I think that's very, very important to take note of, so that when we talk about responsibility and accountability, you can say, well, that applies to leadership. Well, yeah, to a point, but responsibility and accountability also applies to system issues and how well systems are addressing issues. Let's take, for example, law enforcement. I remember many years ago, and many of you are familiar with Dr. Torrey, one of the great champions, and has written many books and articles about NAMI interest and with regards to his profession and service to people with lived experience of mental illness. Oftentimes in many of the articles or clippings that he would write for newspapers, he was very, very critical, and he would oftentimes reflect there was a lack of responsibility and accountability. And many of these articles from his position, if you go back and read some of Dr. Torrey's information, and when he would kind of go off into that criticism, oftentimes was a criticism of the mental health system. Now, again, sometimes just because you're critical doesn't mean that the people within these systems are bad. Sometimes a lot of things, when you're saying that things are not working with regards to responsibility and accountability, a lot has to do with whether or not the political arenas that might be surrounding them, or clearly the funding sources to some of these system issues are not in place. So it's not about people and the lack of responsibility and accountability. Sometimes it's the lack of attention more so than anything else. So anyway, his criticism oftentimes came lack of responsibility and accountability, and as already said, sometimes it's relating to that mental health services or the lack of. And I looked at that and I says, wow. I said, actually that's what makes CIT work. It's from a law enforcement perspective, responsibility and accountability. If it's done like the CIT is performed like it should. You think about it, when a call comes in through dispatch or a call take services, that dispatcher or call taker is receiving information, they're collecting information. They understand their role with regards to getting sufficient information so they can pass on, so they can have a response. Now, I like having dispatch. I'm throwing this in early. I like having dispatchers to attend some of the 40 hours of training, because it brings them a part of the CIT networking from law enforcement. They start to ask better questions. They start to be more probing, trying to find out. And officers out on the streets of their community, they love a lot of information being collected from the dispatch. So responsibility and accountability. The dispatcher then assigns this to a CIT officer, responsibility and accountability. So it follows a trail with regards to services. Specialists, that's what we want. We want a CIT officer to be considered a specialist. We're proud of all of our law enforcement officers, but I talk to many different levels of supervisors. Usually I talk to the first line supervisor within law enforcement, and they all agree that there are some officers within, not all, but within many agencies, some officers are not quite ready to be CIT officers. Number one, they may have just graduated. And even though they've had great training in the recruit training, and I teach recruits, I know this, they're not ready to fit that role. And so earlier I was looking at the great champions that were officers of CIT. I think it was Officer George and Officer Kearns and Corporal Cruz. And I suspect those individuals, I know this, they have good judgment, good maturity. They have passion towards what they do. And, just thinking somebody's going to be exactly like them. No, we're all different and we all have different skill sets. And so they were placed in that position because many of their skills and attributes reflect that. Sustainability is very, very important to CIT. You want to engage in order to nurture CIT where it's sustained. Let me bring up, this is a picture of a house of cards. You've heard that expression. And so when you start looking at this house of cards, you realize it takes talent to build that. It takes, clearly, it was going to take a little finesse. You don't just assemble something like that. But at the same time, when you're looking at that house of cards, you realize that one card taken away, then the house of cards is quickly going to come down. So that it's important. That emphasizes structure and foundation. So you might have something to kind of look at. Wow, that looks really nice. That looks really attractive. And you might be at all with regards to the performance level of building that house of cards. But, that house of cards is not one that's going to take a lot of pushing or pulling because it wouldn't take much for that house of cards to fall down, as the other pictures suggest. Back in the early 90s, there was a movie out, and maybe you've seen that. If you hadn't seen it, I would suggest you see it. Not that I'm getting any royalties from promoting this. I saw it in the 1990s. And when I saw it, I says, it's an okay movie. I didn't think it was great. I thought it was an okay movie. Since then, it's kind of like somebody giving you exposure to some interesting points within that movie that I've really come to appreciate that movie. So if you thought maybe when you saw that in the 90s, it was an okay movie, let's see where we go, and maybe you might change your mind. And if you were to look at it again, like me, you come away with a much more sincere appreciation with regards to that. This is actually, this was the major theme here, even though there's some several different things. The major theme, it was a murder trial with regards to William Santiago. And the two people that were on trial was Lance Corporal Dawson and Private First Class Downey. And they were on trial. And of course, as the trial kind of ensued, other characters were introduced. Lieutenant Caffey was introduced as representing the defense. And then, of course, there's this Colonel Nathan Jessup, and he was a major part of this house of cards that ultimately the movie was shaping up to be. And so these two individuals were on trial for murder, and Colonel Jessup was definitely involved in that, and there was some suspicion of just how in depth he was with regards to this murder trial, and that was the role of Lieutenant Caffey with regards to that. Also, at question was a code red, and that was a kind of a special code. It was a disciplinary type of measure to direct attention for some of those that were in their performance or lack of performance, and other soldiers would call a code red. And the question was, did Colonel Jessup call a code red, which ultimately led into the death of Santiago. So as the trial started off, Lieutenant Caffey was asking a lot of questions, and one of the questions he was asking to Colonel Jessup, he says, well, you came here to Guantanamo Bay. What did you do? And he was asking the questions with regards to the uniforms he was wearing, things of that nature. And there was a little bantering going between these two. I use the word banner jesting like, but there was a significant bantering going between the two that didn't like each other. And so Kathy brought to the attention that, asking Colonel Jessup, what were some of the things that you brought with you? And he said, we brought some clothes, he brought some toothbrush, some other personal items with it. Kathy then introduced a point. He says, it's kind of strange. Santiago was about to leave. The question was, did Colonel Jessup said that he ordered Santiago to leave, to be dismissed, and from that unit. And the question was, and of course, his death occurred at midnight. And so Kathy was asking some questions with regards to it. It's kind of funny that he was supposed to be ordered to leaving at 6 a.m. that morning, but yet he hadn't packed. And that's kind of a hint that something was fixing to fall apart with regards to the questioning that Colonel Jessup was under. And then he goes back to questioning Colonel Jessup, and he discovered that in order for him to come down for that trial, he had to pack uniforms. He made some calls. He called a congressman. He called his sister. He did all kind of planning with regards to accommodating his appearance for that trial. But while he was there, he was going to take care of some other business. The bottom line was that he was planning, and yet Kathy Lieutenant brought out the fact that it's funny how Santiago, he was about to leave, even though he had been passionately trying to get out of the Marines. On the time that he was to be discharged, he hadn't called anybody. He hadn't even packed any of his things. And so he was, how could this be? Well, rather than going into further on that, Colonel Caffey then started to questioning as some of the house of cards started to fall apart. And I would suggest that house of cards started because Colonel Caffey pulled a card called planning out. And so everybody remembers, if you saw that movie, Colonel Jessup says, you want answers? And of course, Caffey says, I want the truth. And of course, Colonel Jessup says, you can't handle the truth. And of course, Caffey comes back and he says, did you order the code red? Did you order the code red? And that was the message. Now, I'm bringing that to your attention only to emphasize how important planning is. And planning is very, very important with regards to doing this. It's not just assembling some great instructors to go through training. Oftentimes planning not only consists of who is going to be instructors and where training is going to be, all that's good. But a lot of times communities and knowing the way that Delaware and Josh and Amanda and all the great NAMI people and all the great mental health people work, they probably had oftentimes very consistently what is referred to as mapping. And mapping has to do with looking at services and how well services are connecting. And when you're doing that, you're actually planning, okay? What is working, what is not working with regards to systems. And that really shows getting engaged as a community to address and make sure those system issues are in place. And not only are they in place, the word I like is seamless. Are they seamless? In other words, is there a seamless delivery of services that not only provides a convenience, but also does so with dignity and respect on this? So where do we start? Well, CIT International has introduced a guide. It's called Crisis Intervention Team Programs. And you could go and get that downloaded or purchase that. That is a great way. And if even if you've got a CIT program, I would strongly suggest you get that guide. And there is some great reading in there coming from experts throughout the United States, both rural and urban CIT leaders, and with regards to their engagement, and it might give you some extra pointers with regards to this. And of course, the emphasis is, now that you got CIT going, what are you doing with it? Are you moving forward? Okay. Are you addressing some of those system issues that you might not have in place? One of the things about sequential intercept mapping that it does, it highlights those strengths that you have, but it highlights those strengths that you may not have. And sometimes people do this at the beginning of thinking about implementing CIT. But let me also encourage you to not just do that from a community engagement where you invite chiefs and mental health directors and family members and people with lived experience to do that, but it's well worth repeating. If you were to do, I would strongly suggest that if you were to do a CIT in-service, which I highly recommend that you do, bring the CIT officers back for an 8-hour training, you could spend the last couple hours of the day to have a mini mapping session. The mental health people, they've got this. They know how to do this. But sometimes engaging the officers that work at 10 o'clock at night or 2 o'clock in the morning, it feels like that they are part of this building part. Usually a lot of times the building and structuring of CIT does not necessarily involve those individuals that are on the streets of your community at 2 o'clock in the morning. And so if you were to bring them back and let them have a voice as to work, you'd be surprised. Sometimes people, they draw little circles and squares and triangles to show the different moving parts of a CIT system. And somebody might draw a square and says, okay, we've got this services over here. And you'd be surprised at some officers saying, well, you might have it Monday through Friday from 8 a.m. to 5 p.m., but you don't have it at 2 o'clock in the morning when I work. And I think that attention like that needs to allow CIT officers to feel like they have a voice with regards to system issues. And many times they don't have a voice. And I don't think that's by design. I just think that we could probably do better making sure that those officers that are on the front at the crisis also have some input with regards to what seems to be working and what might be a future planning session. That goes into nurturing CIT. So building, sustaining CIT, it's all about having those anchors. I talked earlier about a house of cards, and easy that you pull one card, the house of cards start to fall apart. You want to surround your CIT program with anchors. You want to have those in community engagements in place in order to have both short-term and long-term goals addressed. And that needs to be under consideration, part of your steering committee ongoing process. Long-term goals means exactly that. It's going to take a little bit of time, but just because something's difficult doesn't mean that you just push that to the side. It falls under the category of long-term goals. You keep it in front, and it's amazing many of the things that you've already accomplished is simply because somebody says this is important, let's stay with it. And so you should honor yourself for the many accomplishments that you've already made. This is kind of a CIT umbrella, shows you the different players and partnerships underneath. On that, this is just some a lot of new things that are happening under that umbrella now. You're having co-responder programs that are coming into play under CIT. And that's where mental health and law enforcement officers are riding together. I think Newcastle has got a great co-responder program with regards to that. It's very robust and it's working really well for them. But you also got to make sure you're hanging on to the structure of what CIT is. And the structure of CIT is considered to be a first responder program, but we're always happy that more layers of services are going to be attached. This is, everyone has experienced this at one time or another, starting a new project. It's been around for quite some time. And I suspect, I don't know this, but I suspect at the beginning of Delaware's exploration of considering what CIT, they were kind of feeling their way around, maybe not really sure what things are. But once you got a CIT started up, we need to take the blindfolders off, and we need to make sure that we're looking at this. And now, what are we going to do with this giant element? He's going to need to be fed. He's going to have to need to be nurtured. He's going to have to be addressed in order to accommodate a service to the community that works on that. So I love the theme that you have with regards to Delaware's inspiring of hope. I took the liberty to scratch out the word hope, not that that's not inappropriate. I just wanted to add that I want to change the message around here, and I want to look at the success. And the success is that you have brought partnerships together. You've accomplished much with regards to the efforts of making things happen. And I think that's a win-win situation for everybody. And so congratulations with regards to much of your success, bringing the communities together. Here's a caution that I want you to be careful of. And that caution has to do with, excuse me, it has to do with, came out in March 2016. And the quotation was, concern and individual at a conference that I was not a part of. And it says, as we read about these incidents that upset our communities, often it says it involve officers that were trained in CIT. And we ask, how can this be? And I don't think that was a fair question, or at least I wish an answer had been directed that maybe, just maybe, it was not a crisis intervention team program. There's a lot of confusion. A lot of people are using the term training as opposed to team, and they're missing that identity and ownership of what a program is all about. And so these are complicated issues. CIT has an identity, just like NAMI has an identity. If somebody starts to take away some of the core elements of NAMI identity, there's going to be a lot of upsetting people. And I think that some of the people are referring to crisis intervention training, and they're missing the team concept. This is one of our champions for many, many years, wrote a lot of articles, Randy Borum in 2013. He wrote an article and it made a particular attention. He says, providing intense training to all officers may be helpful, but a distinction, a training all officers assumes that all officers are at the same skill level. And that's just not, that's not true. Randy wrote another article in January of 2006. He was talking about the crisis intervention team. He says, without energetic, committed program leadership, it is at a risk to die on the vine. And yes, I'm familiar with some programs that started out very robust, very energetic, very committed. And then they started taking away some of the identity of what CIT was about. It became a training program. They failed to have the word team. And I would suggest team represents an engaging partnerships. And those partnerships, clearly, NAMI's got to be there. The advocacy of NAMI or the advocacy of others that are in the community have to be there. The mental health professionals have got to be there, as well as law enforcement. Other partnerships can be to be there too, but those are the three anchors that really need to be considered. So community program, leadership, partnerships, sequential intercept mapping is very important. Having an identity and ownership. You can't own anything until you can identify it. And that's why CIT has to be identified. And those things that when you're having those great champions in law enforcement as being CIT, that is giving identity of the success that Delaware is having. And not only Delaware, but those communities with regards to those officers that are committing their services to that. These officers are the CIT officers. They're very committing, they're very engaged. They take on an identity because they see their role as a CIT officer. And I think that's very, very important. We've already talked about importance to have mental health programs that are seamless to access. If you have a mental health system in place and the word seamless is not embedded as a performance, then oftentimes law enforcement officers feel that they're forced to utilize the criminal justice system as opposed to the other services, because you're putting the officers in jeopardy of having to decide, do I wait 4, 6, 8, 10 hours when my partner may be calling for help, but I'm waiting 4 and 8 hours and I can't get to my partner. And so these are very much on the minds of the officers, that sometimes in some communities are waiting many, many hours for a disposition to take place. And those fall under long-term goals. And I really think that needs to be played. Do I think we're making headway? Yes, I do. Many of the programs are calling crisis assessment centers. They're having different names, and they're having officers to bring them as opposed to emergency rooms. Emergency rooms have their place, but oftentimes they're under constraints with regards to priority of care on things, which means that officers may have to wait there long periods of times. So CIT, there's a lot of great things that come into play with regards to the fact that they're a specialist, helps to unite the program in a sense that they're having ownership. CIT is considered to be a pre and post jail diversion. Years ago, when mental health court came out, Most of the grants specifically targeted mental health courts, and CIT got mentioned, not really in specifically, but in narratives in some of those grants, early grants that came out. But thankfully, CIT has come of recognition from a national perspective, and many grants specifically are noting to that of CIT. Mental health courts are great. They're part of the layering approach with regards to this, but don't overlook the fact that for mental health courts, that means somebody's got to go to jail. So the real question the steering committee needs to look at, does everybody need to go to jail to get mental health services? And of course, I've been flippant here. You know the answer to that without me having to discuss that further. So partnerships and steering committees is always very, very good. Those partnerships have to have leaders, and those leaders have to be engaged with regards to their services and making sure that the program comes away with an identity, and to making sure that the community and the people that are part of the CIT system is working. CIT, I should have maybe introduced this earlier, but I'm going to do it. I'm taking the liberty of saying you're familiar with CIT. At least the anchor, one of the anchors of CIT is considered to be a first response. So I've already mentioned to you the dispatchers receiving calls. A call classification, that second check mark up there, that's important. A lot of smaller communities, for some reason or another, they do not have a designated call specific to crisis issues, specifically relating to mental illness crisis issues. It falls under a generic classification, sometimes referred to as the disturbance. And sometimes that word disturbance reflects anywhere from a barking dog to neighbors not getting along. And so it's hard to separate just how many calls that are specifically related to crisis issues specific to mental illness. And so a call classification is a good way of extracting it, easy for a computer to extract a call classification to give a data collection of the number of calls that are coming in. And sometimes you have systems that do not have pre and post data, but that's okay. Collecting data is very important. You want to keep up with the data with regards to seeing things that might change with regards to this. This example lets you know all these officers here. Actually, the two officers on the left are actually pictures of two CIT officers. The picture of officers on the right come off the internet. But the point is, both groups, they work together on a shift. But when a call comes in and that's relating to a crisis event, mental illness, that dispatcher is going to find one of those CIT officers and put that officer on it. Now, that one CIT officer may be accompanied by two or three of those officers on the right side of the slide, but the narrative of CIT, since it's a specialist, the CIT is the leader of that particular call event, and seniority does not come into play. Whose ever area is not going to come into play. The fact that that CIT officer was placed on that call means that that officer is the leader on that. That's very, very important, because what that does is it allows for numerous CIT officers to be distributed across the different shifts, making 24-hour coverage. A lot of places having specialized co-responders, where there may be a designated officer and some mental health people, and sometimes they don't necessarily have a full 24-hour coverage, and maybe they only have one or two units. Again, looking at the total call volume to see how many calls that officers are responding to. I know of one community, large community, that their response to crisis calls is 24,000 calls that was specifically targeted towards CIT officers. Now, that's going to take a lot of CIT officers, because that's a very large metropolitan department that's able to do that. But regardless, it doesn't matter on size. You could still have CIT officers embedded in with the the uniform patrol, and we love a lot of people to be engaging. Mobile crisis team, co-responder programs. I've always said there's enough crisis for everybody, and that's a good thing. Well, it's not a good thing, but you got my point. All right, so CIT training, it's more than training. Everybody's heard me say that for I don't know how many years, but training is important. Again, repetitive learning points are very, very critical. And some of the, if you're a trainer out there, you need to make sure that some of this overlapping in training is being emphasized over and over again. Verbal de-escalations that requires not only skills, but some strategies. Fear and psychosis, I think, are two very, very important words that sometimes is not being connected enough. And it may only be connected in one training course, and it needs to be connected in multiple training courses that are being offered during the week. Testing of compliance, of communication, oftentimes is overlooked. Understanding, I already talked a lot about understanding recovery. I want my officers to be able to understand that they are a part of the recovery process that brings ownership to their role of a CIT. So training versus learning. Okay, it's very important. You can have teaching, but it's learning is taking place under the consideration. That's important. These are some topics. I'm looking at the time and I'm trying to hurry here. These are some of the topics of the 40 hours of training. I put check marks by it because just to make my point here, I put some check marks by signs and symptoms, psychosis, de-escalation, and fear. There is a lot of overlapping of those different topics. For example, I would suggest that psychosis is being introduced very significantly into the topic of signs and symptoms. My question to you to consider, is psychosis being introduced into de-escalation training? And let's take the word fear. Is there a connection between fear and psychosis? It's been my experience. Okay, and I also teach law enforcement. I teach both CIT and non-CIT, and so here's what I've been introducing here lately. When I meet with a class and I say, okay, the word psychosis, what does that word mean? Or sometimes sometimes people don't want to raise their hand and all that. And I said, well, sometimes the word is used as psychotic or psychosis. What does that mean? And a lot of times people break it down to something very, very simple. They say things like, it means that the person has a mental illness. I was, well, yeah, kind of right, but not exactly right. And so I go into understanding the symptoms of mental illness and how those symptoms are relating to psychosis features that a person might be experiencing, and how those experiences really oftentimes, not always, but a lot of times, fear is definitely in part of the equation. So sometimes the people that are using the word psychosis and psychotic would be family members or people with lived experiences, or mental health professionals are using that word. And they're giving it to the officers, and many times the officers are breaking it down too simple, I think. They're breaking it down. Oh, you're talking about a person who has a mental illness. Well, yes, but they're using that. So my new way of teaching, I had to come up. I've been trying, I can't tell you how long I've been trying to get the understanding of what the definition means, but I'm not having much success. So here's my new way of thinking. When I'm telling my officers, whenever you hear the word psychosis or psychotic, whoever's given that word, this is what I want you to do. I want you to ask that person, what do you mean? And then I want that person to articulate how they're using that word. And I think that will oftentimes bring up an understanding that there's likely a lot of fear that the officer is about to engage in. And I think that's important with regards to the overall concept of de-escalation, opening up communications, and that's very, very important. So all these are different topics. You can see how well you're presenting good CIT training with regards to it. So I mentioned earlier the importance of CIT refresher training or an in-service. CIT International did a survey of 243 respondents, and most individuals were doing of that was doing an 8-hour or partial day of in-service. That's very important to do. It brings an officer back. It allows them to have an appreciation of a specialization of CIT. It enhances previous learning topics. Okay, if you look down here at the definition of previous learning topics, in the 40 hours, verbal de-escalation, suicide, children and youth, that 40 hours is exactly that, 40 hours. In service, you're able to enhance that. You may only have 1 or 2 hours on children and youth. In service, you're able to expand that maybe to 4 hours. Medication, trauma, all these things with regards to it. New topics. Sometimes the first 4 hours is a refresher course of some of the previous training has been taught. New topics might be introduced: sleep deprivation, sign language, hoarding. These are all important that oftentimes CIT officers come engaged in some of the issues relating to that. And it helps to enhance new partnerships. It helps to open up coordinators to talking to some of the CIT officers about what some of the issues are. So a question and answer session. These are all very important. It helps to expand maybe the wellness topics for the officers. So if you're not addressing some of your CIT in service, I would really push hard for that if you're a steering committee, and try to get some additional training for officers to expand beyond just their traditional 40 hours of training. So CIT is considered a specialist program. We've already talked about that. The question is, are officers volunteering, or are they being forced to go? And even I hear stories that once in a while officers being forced, that they come out with a changed heart. That's good, but that's pretty risky with regards to that. Do supervisors have any input as to who is selected as CIT officers? Are they looking at some of the talents or the attributes? Supervisors know they're men and women that are frontline responders, and they know those skill levels with regards to that. That doesn't mean that a supervisor can encourage. I've seen individuals that would make excellent CIT officers, but they don't volunteer. And I might meet with that individual one-on-one and share the importance and what I see in an individual's talent. And if I'm a supervisor and if I am nurturing my department to make sure that other good people step up to be leaders in the performance of leadership, then I'm not doing my role as a supervisor. So we should be looking for those individual officers who's got those skills and those talents, and encourage those officers with regards to this. Basic recruit training. How well are we teaching our recruits with regards to? Remember now, many of these individuals do not have a full understanding about mental illness. How many hours are we training? Are we introducing some skill levels for them, some scenarios, some strategies? No shouting is very, very important with regards to that. I've found the law enforcement culture sometimes introduce shouting, not necessarily by design, but many of the experiences that oftentimes could be threatening, and they elevate their voice commands. And so that has to be controlled, and that needs to be taught very distinctly, I think, with regards to this. Dr. James and Burl Gilliam and Dr. James and Dr. Kurtzberg, Dr. James and Gilliam wrote a textbook, it's listed at the bottom. And these were some attributes with regards to what makes a good counselor. Dr. Kurtzberg added in a little bit with regards to that. And what these individuals, these are great trainers, and what they have come to recognize was these same attributes that make great counselors also make great CIT officers. Again, looking at skills and attributes and talents, I think is very, very important. Specialists, SRO, school resource officers. Okay, I want you to look at the what the officers' words are here. I got to clear my computer here to so I can read it for you here. It says here, this is from Officer Cochran. He says, in talking about being a school resource, to be a school resource officer, you have to have passion for children. It's got to be inside you, your heart, that you want to make a difference in your community. I would suggest that if emphasis is being given to SROs, and they should be, those emphasis also should be given to CIT officers because they are leadership skills. Job description of school resource officers, you can see up here down at the bottom: even-tempered, patient, attitude, ability to intercept and mediate arguments and fights, ability to interact well with children and adolescents. Again, we're looking at attributes of an officer, of a leader. If you want a person at the performance of a crisis to have these kind of attributes, you're way ahead of the game. And some people might say, well, everybody should be that way. Okay, everybody should be that way, but somehow or another, we're focusing on school resources officers. They need to make that, and I would suggest that they realize that some officers would not make good resource officers. This is a picture of the Alamo. It's important to know our history with regards to things. What a lot of people don't know about our history, Lieutenant Colonel William Travis. He was part of the Alamo. He was credited as drawing a line in the sand, asking the people at the Alamo if they wanted to stay and fight with him to cross the line. Now, some people said, it's a made up story. Maybe it is, maybe it isn't. I don't know. But I would not suggest you go to Texas and say that's a made up story with regards to it. So what is this drawing the line in the sand? Well, a line in the sand means that you are concerned about systems and service issues. You want to make sure they're seamless. You want to make sure there's funding streams for our mental health. That means that the state, county, regions, local, all those governing bodies that oversees funding, we need to make sure appropriate funding is accommodating the quality of care with respect to people who live and struggle and cope with mental illness. Long-term, short-term goals has to be with line in the sand with regards to this. I love this quotation from Will Rogers. Even if you're on the right track, you can get run over if you're just sitting there. So I opened up and I said, is Delaware on is on track? And many of you probably shook your head. Okay, you're on the right track, but if you're not moving, all right, you're going to get run over. So, and I say that kindly. This is encouragement. So what's my point on this? Well, I think Michelle Saunders said it very well. I'm concerned that sometimes mental health and advocacy are not fulfilling their rightful placement as to the CIT ownership and leadership. This displacement or absent fails to initiate or achieve community changes that we are vital and necessary to structure and sustain CIT as a community program. And so I think we all need to examine ourselves. Are we engaging? Are we fulfilling our role as CIT, developing it into a CIT community program? So what is your line in the sand? Okay, so whether you're in rural Delaware or urban Delaware, in rural Delaware, you might have a barn that looks like that, or in urban Delaware, you might find a house that needs some serious repairs. And those are things that should be our line in the sand. That, whether that's representing partnerships or whether that's representing systems that are not seamless, it doesn't matter. But that is something that's got to be a line in the sand. So with NAMI, okay, CIT International, and the mental health providers, you can be that voice. You can be that grassroots voice, joining together in order to shape that barn or that house up into pastures of green grass that nurtures a program that's called CIT, so that CIT will stand for something, it'll have an identity and have a purpose. Okay, going back to the verdict. The verdict here was found not guilty. These two individuals were found not guilty with regards to the murder charge. However, they were dismissed, dishonorably dismissed. And Private Downey looked at Lance Corporal Dawson with regards to this, and he says, "What's wrong? What just happened?" Colonel Jessup said he ordered the code red. Remember, the card that was pulled clearly pointed out that Jessup called the code red. He was trying to deny that he had anything to do with it. And Downey says, "What did we do wrong? We did nothing wrong. We followed orders. That's what we're supposed to do." And Dawson had one of those moments. He says, "Yeah, we did. We were supposed to fight for people who couldn't fight for themselves. We were supposed to fight for a Willie." So what are we supposed to do? What is CIT supposed to fight for? Your community. What are you supposed to fight for? Are you fighting for those things? Are you fighting for housing? Are you fighting for more recovery programs? Are you fighting for a specialist program within your community? Are you fighting for those partnerships to be engaging with other leaders within your community? There's a lot to fight for. We have accomplished a lot, but we've got a lot more to accomplish. And I apologize for going so long. So if I could give this back to you, Miss Amanda, maybe you could, it looks like I got 1 minute.
Thank you so much, Major Cochran. We do have 1 minute. I'll try and get maybe 1 or 2 questions in. People may need to leave, but we had a question come in that asked, how do you suggest engaging higher ranking officers so that the leadership sees CIT's importance and kind of disseminates that throughout the police department?
That is really hard if you're speaking from a rank, a patrol rank. That is really hard to do. Two comments. It really a steering committee, and we need to look. Do we have steering committees that are helping to promote CIT? And those steering committees need to be made up of NAMI members and mental health people, and they need to be out front echoing the specialization that's very, very important. And let me just, I don't mean to be flippant or cute by it, but it is true with regards to the relationship that I have with CIT from the past. The part that I wanted to hang on just a minute here. The part that I wanted to kind of articulate is that many times people says, well, how did you deal with supervisors, Sam, when CIT was first introduced? And I says, well, I had to outlive them like dinosaurs. So I had to treat them like dinosaurs and just outlive them with regards to doing the things that I was doing. And that's important with regards to don't give up, with regards to it can be a real struggle with regards to the things that we're all trying to do, and that's to create a program that has some type of an identity.
Great, thank you. So we'll do one more question that I received, and then we'll probably cut it off there. If people have additional questions, they can always send it to NAMI Delaware. We can try and get them answered. And this presentation will be recorded and up on NAMI Delaware's website at the conclusion of the conference in case people want to revisit it. So the last question would be, do you have examples of other places or some good examples of places that are addressing the systematic issues really well? And if so, can you maybe name a few?
Yeah, well, I'll name you what I think from a system-wise would be a gold standard, and that's Ohio. I like how they're doing things. I like how they're operating from a state level with regards to this. I think that they're doing excellent. A lot has to do with the engagements of your State Department of Mental Health. I have found that if you get champions within your State Department of Mental Health, and I think you have that in Delaware, they can't solve everything. Remember, they are part of government and with regards to this, but having those champions in there makes a difference on that. So I find that they're a critical to keep them part of the CIT movement on that. So Ohio would be a great champion. There's a lot of states that would probably say they're all the worst with regards to it, but that's not fair. I think if you've got people that are doing the best they can and they have an advocacy voice, then that's part of those long-term goals. These things are not issues just because you go in and saying, well, we need to do this. I don't mean to suggest that I know all the issues with regards to funding streams and things. And I know it's very, very challenging because there's a lot of voices those legislators have to listen to. But, you know, if you just keep on and you move some of the things, I think in my passion is to have programs that's often referred to as a crisis assessment center, to where I want to separate the officers from the people in crisis as quickly as possible. If you can do that, I can assure you, you will greatly minimize some of those minor misdemeanor charges that are oftentimes placed on individuals that unnecessarily are going to the criminal justice system. Just be careful and may understand there's always going to be people because of the nature of the crime that will have to go into the criminal justice system. But in our country, we got way too many people going into the county jails of America that do not need to go to. All you have to do is look at the narratives of why they're there. And you tell me that person needs to be there. And I would suggest that you look at why they're there those systems that are not in place to separate the officers. And officers have a very difficult challenge ahead of them. What am I going to do with regards to this individual that may be cursing on the side of the street corner? Do we really want to put that individual in the criminal justice system, or do we want to bring that individual some nurturing care with regards to great mental health services? And you know the answer to that. Sorry, my answer was long.
No, that's great. Thank you so much, Major Cochran. We appreciate you taking the time out of your day to give this wonderful presentation. And we hope everyone else has a great rest of their day.
Yeah, do I have 30 seconds more?
Sure.
Okay, I apologize. So here's what I want you to do for me, Amanda. Excuse me. I can't do this to all the winners, but the three officers, Officer George, Officer Kearns, and Officer Cruz, if you would send them my contact, I'd like to purchase a year membership of CIT International for them, and if they would send me their contact where I could get some information, I'd like to sign them up to be members of CIT International. That would honor me. And again, I apologize not being able to do everybody on that. Maybe next year I'll reach out to some of the other great winners on your list to do something like that.
Wonderful. Absolutely. We'll definitely do that. Well, thank you again, Major Cochran. We appreciate your presentation.
All right. Thank you very much.